Dear friends, welcome to our channel. Today we will talk about gallstones, how to treat the gallbladder, and whether it should be removed. Gallstones are crystalline structures that form from normal bile. Surprisingly, they are formed from cholesterol, calcium salts, and a substance called bilirubin. What causes gallstones to form in the gallbladder? Stagnation of bile is the primary cause of their formation. It is important to note that stagnant bile leads to the formation of stones, especially in cases where people take certain medications. Firstly, medications for cholesterol, known as statins, can contribute to this. Secondly, uncontrolled intake of calcium supplements can also lead to gallstone formation. Currently, it is common to take calcium supplements for months or even years, especially for the treatment of osteoporosis. People are often advised to take them daily for an extended period of time. This uncontrolled intake of calcium can lead to the formation of gallstones. In addition, the use of certain female hormones is often associated with the formation of gallstones in the gallbladder. Other well-known factors include excessive alcohol consumption, a sedentary lifestyle, stress, and the consumption of fatty foods. How does gallstone disease manifest? In some cases, it may not manifest at all. A person can have gallstone disease without any noticeable symptoms, even if there is a large stone in the gallbladder. If the stones are small and they move, gallstone disease can manifest as episodes of liver colic. This occurs when a stone moves and irritates the walls of the gallbladder or bile ducts, causing sharp pain. However, once the stone has passed, the pain disappears. Another variation of the disease occurs when there are many small stones that continuously traumatize the gallbladder and ducts, leading to cholecystitis, inflammation of the gallbladder. In this case, it is called calculous cholecystitis. Calculous cholecystitis often presents with pain in the right upper abdomen, which can radiate to the shoulder blade and even the shoulder. They can be accompanied by nausea and vomiting. In general, it is quite an unpleasant condition. However, a much more unpleasant condition is the obstruction of the bile ducts. If a large stone blocks the bile ducts, severe pain usually occurs. Jaundice may even develop, which is an extremely unpleasant condition. In this case, typically, such a stone needs to be removed surgically. Nevertheless, surgery is considered a last resort. This is because it has its consequences, which we will discuss later. In most cases, it is advisable to try to treat gallstone disease without surgery. This can be done through various methods, such as medication or herbal remedies. But before we can treat the gallbladder without surgery, we need to know that there are several conditions when it is possible to do so. Firstly, the stones should not be very large. Ideally, they should be no more than 15 to 20 millimeters. This is the first condition. Secondly, the gallbladder should maintain its contractile function. And thirdly, the bile ducts should be clear and passable. If these three factors are met, we attempt to treat gallstone disease without surgery. We try to dissolve and expel the stones. How can we do this? The first step, which not many people know about, is to start the treatment of gallstone disease with the intake of antispasmodics. This helps the stones to freely exit the gallbladder. What medications can be used? Well-known medications such as no-spa or papaverine can be used. Take no-spa or papaverine only once, and on the same day, start taking medications for stone dissolution. These medications are known as carafate or Actigol. They need to be taken for a long time, even for several months. It is important to know that these medications have contraindications, which you can read about in the instructions. But the most important thing to know is that these medications work very well in dissolving so-called cholesterol stones. However, if the stones consist of calcium substances, carafate or Actigol may not be as effective. How can you determine if your stones are cholesterol or calcium? Fortunately, calcium stones, which are more difficult to treat, are relatively rare. A doctor can determine the type of stones, and it is quite easy to do so. On an X-ray, calcium stones will be visible as volumetric formations. They are well distinguishable on an X-ray, unlike cholesterol stones. If you have calcium stones, then it is important to understand that the mentioned medications should not be taken. In fact, it is highly likely that calcium stones will require surgery. They are not very responsive to treatment. However, I must reiterate that this is a rare case. In most cases, the stones are cholesterol-based and soft. They can be managed not only with medications but also with herbal remedies. What herbal remedies can be used to get rid of stones in the gallbladder? In my opinion, there are 4 main herbs with proven effectiveness that work very well in dissolving stones in the gallbladder. The number 1 hit on this list is corn silk. In my opinion, in second place is dandelion root or burdock root. And the next medicinal plant on this list is birch buds. Of course, there is no need to use all of these medicinal plants at once. Choose one of them and try to treat yourself with it. If it doesn't help, move on to the second one. And then, as a last resort, try the third or fourth one. In other words, I'll repeat once again. Treat yourself with either corn silk, dandelion root, burdock root, or birch buds. And now for the most important, and perhaps the most crucial information. When you are trying to fight gallstones, whether with medication or herbal remedies, don't forget to drink a liter of water daily. Not 2 or 3 liters, as some hot-headed individuals may suggest, but at least 1 liter of water is necessary. Because it is the lack of water that makes bile thick and sticky. And one more thing. If your stones are not very large, as we mentioned earlier, it is essential to stimulate the gallbladder by moving and trying to walk more. Additionally, special therapeutic exercises should be done. And, of course, in conclusion of the discussion on non-surgical treatment of gallstone disease, we must mention the diet. Diet number 5 is used in the treatment of this disease. You can find it on the internet. And it is important to know that during the treatment, you need to reduce your consumption of salt, smoked foods, fats, and, of course, alcohol. But these are all common knowledge, and you probably already know that. And now let's smoothly transition to the surgical methods of treating gallstone disease. Before removing the gallbladder, you can try to break up the stones. This is not exactly surgery. It is more like something in between operative treatment and physiotherapeutic procedure. Stone fragmentation is performed using ultrasound. Ultrasound in this case breaks the stones into sand-like particles. It is a good and effective method. But unfortunately, it is not suitable for everyone. There are certain conditions when this procedure can be performed. The stones should not be very large. No more than 2 centimeters. The gallbladder should not be inflamed. There should be no signs of cholecystitis. The stones should be soft, meaning cholesterol-based. Calcium stones break up poorly. And they break up with sharp edges. And one more important condition. The gallbladder should maintain its ability to contract normally. Another option for a minimally invasive surgery is a relatively new procedure called percutaneous cholelitholysis. During this procedure with such a complicated name, substances are introduced into the gallbladder through the skin and through the liver tissue to dissolve the stones in the gallbladder. And the good thing is that in this case, not only cholesterol-based stones, soft stones can be dissolved, but also fairly hard stones, including stones with calcifications. The downside of this procedure is that sometimes it needs to be repeated 2 or 3 times. Now let's move on to the surgical treatment, the removal of the gallbladder. Sometimes the gallbladder is removed through an incision using conventional methods, and sometimes it is removed laparoscopic. The latter is a more gentle operation. At first glance, the operation to remove the gallbladder permanently relieves a person of all problems associated with gallstones. However, I am not a fan of this option. Removing the gallbladder may solve one set of problems but can lead to others. The gallbladder is a necessary organ in the body, serving as a reservoir for storing bile. After its removal, the mechanism of bile release is disrupted, leading to uncontrolled flow into the intestines. This disruption can result in impaired absorption of lipids, fats, in the intestines and digestive disorders. Metabolism of fatty acids is also affected, and the breakdown products can irritate the intestinal mucosa, leading to inflammation in the duodenum and small intestine. Gastritis and gastroesophageal reflux disease (GERD) may also develop, which is an unpleasant condition that often occurs after gallbladder removal. In summary, approximately one-third of people who have their gallbladder removed experience various digestive problems and unpleasant sensations. In addition to the mentioned conditions, inflammation of the intestines, gastritis, or esophagitis may occur, along with other discomforts such as bitter taste in the mouth, nausea, heartburn, flatulence, pain in the right hypochondrium, and alternating constipation and diarrhea. It can be an unpredictable bowel movement. Another unpleasant condition that sometimes arises in people who have had their gallbladder removed is skin itching. And now, let's put an exclamation mark. Approximately one-third of patients who have had their gallbladder removed develop liver dystrophy and fatty liver disease. Another strange fact is that some people who have had their gallbladder removed due to gallstones continue to develop small stones. However, these stones now form in the bile ducts instead of the gallbladder. So, gallbladder removal surgery does not always solve all problems, and can even lead to the formation of new ones. So, what should people do if their gallbladder has been removed? They need to seek treatment and take certain actions. First, after the removal of the gallbladder, after a certain period, usually 2 to 3 months, has passed since the surgery, therapeutic exercises should be started. Next, to make the bile less viscous, it is important to drink 1 to 1.5 liters of water per day. Additionally, herbal medicines can be used, such as corn silk, milk thistle, dandelion root, and burdock root. Chamomile or calendula can also be beneficial. After gallbladder removal, these herbs can be mixed together and used in combinations. Some patients find relief with a medication called acapentolate, but it is essential to read the contraindications before using it. Many patients also benefit from enzyme preparations, including those used for pancreatic treatment. In cases where heartburn or gastritis develops after gallbladder removal, medications such as omeprazole can be used for a certain period of time to reduce inflammation in the gastric mucosa. The duration of treatment with these medications usually ranges from 2 to 3 weeks to 1 month. The choice of specific medication after gallbladder removal varies from person to person, so it is necessary to try different options and determine which one works best over a certain period of time. That's all for today, dear friends. Stay tuned and subscribe to our channel. Be healthy. Take care.